I'll just let Arri speak on is COVID-19 a real concern during today's protesting? You already spoke on that, Charlaine. Did you hear Arri?
I'm sorry, if you could repeat it.
Is COVID-19 a real concern during today's protesting? Which you guys already began speaking on.
Yes.
So I would like to hear your thoughts on it.
Again, because this is a safe space, I was told that there was a lot of contact tracing to a protest that we had here in Fort Lauderdale, as it relates to new cases. And I'm just nervous because I don't know if that is true or if that is something that has been told to discourage us from protesting. But there were a lot of people who were present who weren't wearing masks. And I don't know what it is that people feel, like what makes them feel invincible. I don't know what to do. You know, on a personal level, all we can do is tell each other to wear masks. But if they don't, you know, I was at one of the protests trying my best to keep my distance from those who weren't wearing a mask. So it's definitely a real concern. And just in case those statistics are true, let's just take heed, you know, because not wearing a mask is not going to impel the movement.
Exactly.
I also think just go by your own personal conviction. If you feel personally convicted and personally led to go protest, then you go protest. If you feel led to go stay home. I mean, at the end of the day, whether there's a pandemic, there's always a degree of risk and a degree of putting your life on the line when you're protesting. You know, I mean, it's been a lot of more public conversation about it, but like protesting is not just going out there and hanging up a sign. Like you actually put a target on your back when you protest. You know, you're in risk of getting arrested. You know, you're in risk of retaliation. Like there's so much. And even back in the day, like there wasn't no COVID-19, but folks were getting hosed and getting, you know, terrorized by the police. And so there is a level of risk. And this COVID-19 this happens to be a new risk. So if you feel led to protest, I don't think there's no policing on that. Just take adequate precautions. And if you feel led to do something else, be mindful as well. That's where I stand on it.
I think the key word with all that we're saying here, whether it be, you know, how you keep yourself safe, how you keep yourself healthy, it's really mindfulness. Practice mindfulness for your own self-preservation, and so that you can continue to fight, but also practice mindfulness when it comes to the actions that you are taking, the behaviors that you are engaging in to protect others.
I have a question, since I have so much intelligent Black women on the line. How are you encouraging this generation that feels invincible to COVID-19? Or how can we encourage? Because the newspaper wants to start an initiative this week with pictures of little kids, maybe thinking that if children are wearing masks, that we would want to protect our babies. And maybe we need to toss some pictures of the elderly in there. But how do you guys feel that we can impact our generation, those who are younger than us?
I think that because impact happens on different levels. So I'm thinking like, where do I want to go with that? But I think that we just have to just normalize, because I think what's causing a lot of folks not taking it seriously is folks having distrust about the media, folks having distrust about the elected officials and how they're talking about it. So folks are just kind of feeling like this thing's not real, there's not much cases. And I think that folks at the end of the day have to understand, regardless of all the facts or this and that, the fact that there are real things happening in relation to the virus is the thing that we have to take in consideration. So the real things of, hey, there's people, I know someone who just caught the virus. I know somebody who family died from the virus, who lost parents from the virus. You know, I am also, you know, I'm Ghanaian American. So I know people who are impacted globally in terms of they can't eat because the shutdown caused starvation. Like there's so much real instances that are actually happening. And I think that for young people to understand is you may have your distrust with the elected officials or with the information that you're getting, but also there's truth in stories and there's truth in personal experiences. And if you know that there's people having these personal experiences, do what you can to take precautions. So it's, you know what I'm saying? Like, it's not even just wear a mask, wash your hands, and quarantine and stop hanging with your little friends, but it's also like, hey, if you can donate to a few food banks, can you do that too? Like, can you donate to some food banks? You know what I'm saying? Can you sign a couple of these petitions that's out here? You know, can you do some of that work, you know, as well? And then honestly, there's some tough love too. I had a friend that she kept, you know, her niece wanted to keep going to her friend's house. I said, you better tell her next time she comes, the door locked. And she had the door was locked because it's like, you're not taking it seriously. So boom, you know? So I think that it's just a level of, I think it's mistrust that's causing folks to kind of be like, I don't need to take it that seriously. And folks need to understand, well, you need to trust the personal experiences and the real stuff that's actually being affected by real people. That's what you should trust if you can't trust anything else.
You know, in my field, one of the things that we always like to do, and it kind of touches onto what you were saying, Essie, about the experience and the stories, but what we especially like to do with the children is to expose them, okay? Pre-COVID, for example, we would take them out to, you know, someplace that has a high population of homeless, for example, so that they can see with their own eyes. We would take them to a hospital so that they can see and understand, to talk to people, etc. And maybe that's what we have to do. We need to talk more and stop sugarcoating these things, because our children are much smarter than what many of us, you know, think they are, despite their age. You know, they could be 3 years old, they understand. They understand when someone is sick. They understand when someone is hurting. And so we need to have these real conversations and demonstrate the types of behaviors we want them to model as well. We need to be those role models for them. And also we can show them, you know, the best example I can think of is one of the things that we used to do. We used to have this kind of substance we would put on people's hands. And we would tell them, wash their hands, and we would turn off the lights and say, well, how well did you wash your hands? So that they can visually see why it's important for them to wash their hands, and the technique that we showed them, because they didn't get all that goo out under the UV light. And so that helped them to really understand why the hand washing practice of, you know, singing the happy birthday song, etc., and doing all of the scratching, the scrubbing, the rubbing, and all of that, in order to get rid of everything. So with children, do not be afraid to use different types of techniques to demonstrate these things, to demonstrate how does you know, disease spread, for example. But again, just talk to them. They are adults in training, so talk to them clearly about what's happening, why it's happening, and allow them to also ask their questions that they may have, because this too is a learning experience for them. And that's really how we get to shape the consciousness of the future, by what's the word I'm looking for, but by developing more empathetic young people.
To answer your question, Arri, I'm thinking about talking to somebody like, I guess, the early 20s to my age. I would say just kind of saturation, I guess, of those same personal stories to those people they can connect to. I always love storytelling or TV shows or movies that I can see myself in. So I think it's the idea of kind of destroying the construct of invincibility with youth, because that is married together. And I think it's also a little bit of grief. They're grieving the previous life that they cannot right now live, because it's like, oh, I used to be able to go out, I used to be able to do this, and now all these things are not safe. So as we spoke earlier about mental health, a lot of people are not taking the time to say, why am I doing this? Why am I risking it all just for this temporary feeling? Because people are always in this search of just happiness and certain experiences and adventures that are just now too dangerous, and they need to understand the gravity of just taking a pause and just, as you say, bring up promoting more of the community idea, the communal idea of just, okay, I need to protect my family, I need to protect my friends by, oh, instead of hanging out with you, let me FaceTime you. Because people don't understand that. A lot of people are crying, I didn't get to do prom, which is, you know, hard, because I got to do that. Like, I didn't get to do prom. I didn't get to do grad bash. I didn't get to do certain things. I didn't get to go to graduation. A lot of grads didn't get to walk across that stage. So people might be reacting out of those experiences that they felt that they've been robbed of. So I think it's just kind of saturating of seeing like, hey, look at this person. They're in the hospital suffering from these symptoms and they're 22 years old and they're 18 years old and they're 25 years old. Like, this is real. This can happen to you. So it's like, you know, you're not invincible. You know, your body can, you know, you can get exposed. So I guess just saying those stories over and over and over again and putting those images will help, I don't know how you say undesensitized, but they're kind of desensitized to that this is real. So you kind of make this into some big folklore, like it's not really real, because you rather experience this adventure than to just kind of protect yourself for the long run.
I'd like to add to that, Arri.
Oh, girl, sorry about that.
No, that's okay. We both started speaking at the same time. No, I just wanted to say, Arri, even with that saturation, though, of the stories, there still has to be a balance, because just like we were speaking of earlier, feeling overwhelmed when there was too much coming at us, it's just really trying to find that balance where we're showing people these things exist, but also showing people the positive side of things as well. You know, showing how people are able to recover when they exercise. You know, the things that their providers are telling to them. You know, sharing these stories, I believe, will help to allow people to see these people look just like me. You know, they're young, they're old. You know, they're married, they're single, they're immigrant communities, you know, whatever. But try to definitely have a balance, because you don't want to have people say, you know, I don't want to read this because it's the same thing over and over and over again, because then they do become desensitized, and we really don't want that. So definitely balance the good, the bad, and the ugly.
I was gonna say that the truth is complex, so nonetheless, there's always gonna be a bunch of good, bad, and ugly. I was gonna say the balance should come from having accessible solutions, and just practical, accessible solutions, because after you tell someone bad news, it's like, okay, so what I'm supposed to do? Like, just not be happy for like 4 months? Like, you know, like I'm just being honest, because it's like some folks were like, yeah, go get a mask, and like I go look at the mask is like $100. I'm like, okay, so what I'm supposed to do? So like, also making the solution and the response to the pandemic more accessible, more practical, more realistic is also that balance that you need. Because like, if you tell somebody like voting, you know, blah, 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 this and that, but it's like, okay, but I'm gonna vote. Like, you gotta also give them like
absentee ballots.
Yeah, like you gotta give them the tools to actually be successful. So it's kind of like telling folks, like, I kind of like the kind of how folks have been doing these Zoom parties. I kind of like the versus battle. It just kind of is making the current situation, you know, adding
manageable,
making things a little bit feel normal, even though they're not, and kind of like, you know, I ain't gonna do all this stuff. I can come here and, you know, like finding different solutions and things that are just a little bit more practical, accessible, like outside wearing a mask, you know, like even sometimes, you know, I see places giving folks masks. So it's one thing to turn people away that they can't come into a store because they don't have a mask, but then here, it's easy. Go put a mask on. Now you can go do your thing. So I think that coupled with like the real experiences, people also need something accessible and something practical to apply what they need to do about it.
And then to Essie's point, giving ideas of alternatives to help them cope during this time. Okay, well, you're used to going out to partying or something like that. You can still go out into an open park. You know, you can still meet up with your friends, but just socially distance. You know, you can still see each other and enjoy the sun, for example. So it's trying to come up with alternate ways to continue to engage with people. Unfortunately, I read a study that people have become more disconnected as a result of COVID. And obviously we know with the Zoom environment that it's becoming too much on people's visions and their fatigue and things like that. So providing those alternate routes of engagement and safe engagement, would be a great thing to also provide to those individuals who are getting these stories and feel like they have nowhere to turn.
Thank you, ladies, so much. I appreciate you all.
No problem. I can't wait to read it.
That's right.
Yes.
Well, thank you, Arri, for that almost final remarks kind of question. And it helps you help me help you. I definitely appreciate all the knowledge that you and gems that you drop, especially all of you with the solutions, readily available solutions. I think that's definitely what we're missing, along with community, this ideology, all of us coming together and just trying to push through. So again, I want to thank you, Arri, Essie, and Charlaine, for coming through for the first time. IMB Woman Girl Talk. Definitely going to wrap up here. This is definitely going to be available on Facebook, Instagram platforms, and imbwoman.com. Again, ladies, if there's any final remarks, let people know how they can follow you, where they can reach out to you. Essie?
Yeah, I mean, if you want to get in contact with me, you can reach out to me. I'm on Instagram at Empress Essie. So I don't know if I send you that at name, but I guess I'll just drop the at since we're on the video, at EMPRESSESSII. And if you have any questions or want to figure out how to get plugged into different stuff, I'm all ears, I'm all open. But it was a pleasure having this conversation with you all, and just stay safe, and that's all I gotta say for y'all.
Arri?
I want to thank you all too. Thank you for this platform. Thank you, ladies, for your input. This has been encouraging for me this Sunday. And if anyone wants to follow me on IG, it's HeavenSent928. And also look into www.the Gazette as an alternative news source.
Yes.
Black news is just different from what we're watching on TV. So please have it.
Well, I will be the only person that will not provide a social media platform because everyone in my family knows I hardly check it. But I will say this, if you do want to get in touch with me, you have my name on the screen now. You can simply Google me, you will find me. My contact information is readily available, and I'm always here when it comes to those who are maybe in the public health sphere, who are looking for ideas for health education and things of that nature, especially as it pertains to the Black community.
Okay. And you guys, again, you can definitely follow us on Instagram at IMBWoman. And also you can find us on Facebook, IMBWoman, and our blog, imbwoman.com. Again, thank you so much, ladies. I hope to speak to you again in the future. You dropped so much beautiful knowledge. Peace and love, and have a beautiful, wonderful Sunday, everyone.
Black girl magic to you all. Bye.
Bye. God bless.